There are various unusual types of breast cancer, and one of those variants, if you will, is called signet ring. Signet ring is the way the pathologists describe how the cells look under the microscope, and I'm just going to focus a little bit on signet ring carcinoma of the breast. Pure signet ring carcinoma of the breast is extraordinarily rare, with only a few cases reported in the world literature. But in my own practice, perhaps maybe once a month even, we'll have the pathologist at our multidisciplinary conference point out to the slides that we show at the conference and say, please note the signet rings that are here. So we received a question about signet ring cancer of the breast. What's the significance of it? What does it mean? Is it more aggressive, et cetera, et cetera? So the designation, if you will, of signet ring really comes from a breast pathologist who knows what he or she is really doing. And I have previously done a video at Breast Cancer Answers about the importance of the breast pathologist, and this is really emphasized in my description to you. And I'm not going to go through I can't go through a lot of the details of trying to describe what it is, but if you hear about this in your diagnosis, little antennas should go up. Signet ring cells can make up a few within a breast cancer on up to several or many, maybe averaging around 10% of the different cancer cell populations within a specific cancer. What does this mean? We can see signet ring cells with invasive lobular cancer. We can see them with invasive ductal cancer, even in situ cancers. What it means is that this cancer is more aggressive, which means that we need to look upon the treatment of this from a multidisciplinary perspective in a more aggressive way. Certain forms of signet ring cancers can metastasize even in stage 1 patients who present with lymph nodes being negative, and then a few years later or so have a failure elsewhere in the body, and for some reason it has a propensity to potentially metastasize to areas like the stomach or the bladder and even be confused with diagnoses with these organs. So if you've been told that you have signet rings or a signet ring cancer, if you will, of the breast, once again, I want to urge that you be in the hands of a high-end multidisciplinary team. Typically, such a cancer is going to require everything that we've got, including the appropriate surgery, the appropriate chemotherapy, the appropriate radiation therapy. As always, think multidisciplinary care. Please get yourself in the hands of such a team. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.